The name of my study is the Shabaab study. I've read several articles that show associations between discrimination and sexual risk behavior among primarily African American and Latino men who have sex with men, and how those experiences are associated with risky sexual behavior. So I became interested in looking at those associations among the Arab population in the United States, because while historically they've been counted as white on the US Census, they don't necessarily share the same experiences as most white Americans. They should be counted as a sort of separate population the way we already count African Americans, Latinos, Asian Pacific Islanders. There's a whole slew of minority populations for whom we look at disparities or their health outcomes separate from the broader population. And so I was very interested in looking at those associations among Arab men who have sex with men, or Arab MSM. I decided to take some measures that have been used for studies on Latino MSM and sort of mold those into measures that can assess or analyze experiences of discrimination with Arab MSM living in the US, to create a survey that can be taken privately and very easily, not collecting any identifying information. That was also very important, and it was important to the IRB, and something we thought a lot about. And so you can see, here's the screener. We ask a few questions to make sure that the person is eligible. This is kind of what the respondent sees. The bulk of the survey asks about experiences of discrimination. And the spreadsheet doesn't look very exciting, but as you can see up at the top, you have here's one measure: how often have you been treated differently at work because you are Arab or Middle Eastern? It's a Likert scale that goes from none of the times to many times. The challenge with a survey like this: how do you capture discrimination in a quantitative study? You quantify answers or responses to things like experience with discrimination. So in the end, what we'll do is we'll add up these scores. Each respondent will get a level of how much discrimination they've experienced, and you get a sort of a continuous variable. Another thing we really don't know about Arabs living in the US, and in fact I think more broadly even in the Middle East, in the Arab world, is HIV prevalence, because it's still a very taboo topic. It is a pilot study, it's a small study, the sample size isn't very big, but I wanted to get the ball rolling. I wanted to open up that conversation, A, because I think it's important for the community to talk about those things, as uncomfortable as they are, and B, because I want the broader public health community to think about Arab Americans and their health disparities as a separate population, and how some socioeconomic things, some structural things can affect their health the way they have other minority populations.